The PulseCare Bedside Pulsed Irrigation System is the first completely closed bedside pulsed irrigation system designed for bedside use on ambulatory and non-ambulatory patients in hospitals, nursing homes, outpatient clinics, or patients' homes. For all patients undergoing CPI treatment, observe the following carefully. Check the doctor's order and assess the patient's condition. Identify the patient's allergies to topical solutions or medications, including cold sensitivity issues. In this case, warming the solution for 10 minutes in a basin of warm tap water is an option. Explain the procedure thoroughly and provide privacy to the patient. Before the CPI procedure begins, be sure to prepare the location and yourself. Place a biohazard bag in a nearby container. Wash hands and put on gloves. Place a linen saver under the treatment area. Remove the soiled wound dressing. Discard the dressing and gloves in the trash bag. Sanitize hands and apply new gloves. Clean and dry the peri-wound skin. Both therapist and nurse should assess the wound. Set up the CPI system according to the manufacturer's guidelines with the appropriate irrigant. Wash hands. Hang the bag on an IV pole. Open the CPI packaging. Put on gloves. Hang the hand unit from the IV pole. Attach the compressor to the bag and attach the tip. The therapist should now gown up. The treatment team should now work together to position the patient comfortably, keeping the treatment area close to the edge of the bed to create an easy downward fluid flow into the collection bag. Lateral side lying position is best for sacral and trochanter wounds. Supine position with back slightly up is best for anterior, chest, abdominal, shoulder, or neck wounds. Now, apply a PulseCare CPI bag to the area being treated. Unfold collection tubing and collection bag. Place the collection bag in a container. Be sure the collection tubing is not twisted. Center the bag opening over the treatment area. Secure it to the skin by removing the tape backing and smoothly applying the pre-taped bag around the treatment area. If leaking is an issue, the use of a benzoin spray can help to create a barrier film on the lower peri-wound skin to assure a watertight seal. The upper perimeter will not leak. Put on a protective face mask. Tear off the perforated end of the treatment sleeve and insert the irrigation handpiece. Hold the sleeve around the handpiece and begin treatment. Irrigate the wound using the pulsed irrigation hand unit with the prescribed solution. Be sure the solution treats the entire wound with attention to necrotic areas. Irrigate until the prescribed amount has been administered. At the end of each treatment, remove the irrigator hand unit from the access sleeve on the bag. Hang the hand unit and attach tip in the tip down position on the IV pole. This will prevent reflux of any residual fluid into the irrigator. Holding the hand unit with the irrigator tip down, use a bleach or alcohol-based Sani-Cloth to completely wipe the exterior surfaces of the irrigator tip. Place a plastic glove over the irrigator tip for overnight storage and reuse. After treatment is completed, carefully remove the adhesive bag from the patient, beginning at the top so all fluid is contained within the closed system. The treatment team should assess the wound post-treatment. Apply a dressing as ordered. Discard all protective attire and dispose of properly. Dispose of the fluid and bag according to your facility's protocol. Label the IV pole with the patient's name and date and cover it with a bag. The following must be recorded in the medical record: date, time, amount and type of irrigant, appearance of the wound pre- and post-treatment, the patient's tolerance to the procedure, and the dressing applied. CPI treatment is also easily performed in an outpatient setting. As with all CPI procedures, remember to observe patient privacy at all times. Position the patient comfortably for wound irrigation treatment, and observe necessary safety and sanitation precautions before beginning treatment. To resume treatment, remove the IV pole coverlet and confirm the patient's ID. Wash your hands and put on gloves to remove the dressing. Thoroughly clean the wound with a Sani-Wipe. Gloves must be changed before moving to the treatment phase. Clean the tip of the handpiece. A gown should be donned first, then clean gloves. As with the adhesive bag, unfold the collection tubing and collection bag. Place the collection area in the biohazard prepared container. Again, be sure the collection tubing is not twisted. Place the extremity bag over the treatment area and secure the open end, placing a towel around the top of the bag. You'll notice that the extremity bag offers various sleeves for best positioning. Put on a mask and tear off the perforated end of the preferred treatment sleeve. Insert the irrigation handpiece. Hold the sleeve around the handpiece and begin treatment. Periodically assess that the wound is being thoroughly cleansed and make sure the fluid is draining properly. Adjust the bag as needed. Note the handpiece has a lock feature for a continuous flow. After treatment is completed, carefully remove the treatment bag from the patient. Universal sanitation precautions should be observed for disposal of all used items into the red biohazard bag. Again, sanitize and return the handpiece to the IV pole and cover it with a bag for later use. Make the appropriate notes in the medical record: date, time, amount and type of irrigant, appearance of the wound pre- and post-treatment, patient's tolerance to the procedure, and dressing applied. For complete written instructions, see the CPI system manual provided with this training video. Clinicians are required to complete a competency evaluation prior to utilizing the CPI on a patient. The checklist can be accessed through the Human Resources page on Village Square.